Because my mother had breast cancer and because I was concerned about that, it was a very high risk for me. I made sure that I had the Mayo Clinic insurance that would cover me at the Mayo Clinic, always. And so when this popped up 10 years ago, we did the normal mastectomy, chemotherapy, radiation, and things were going really well. And then 2.5 years ago, it metastasized. And one of the things that impressed me then, and this is what I was thinking about while I was on the table with the last treatment, is that when it metastasized, the chemo that my oncologist, Dr. Tim Hobday, put me on was one that didn't exist 10 years ago. And that philosophy of being able to hang on long enough till the next great thing comes along is just been a really big part of my journey.
Mrs. Robb is undergoing a treatment that we call stereotactic body radiation therapy. And what that entails is the use of technology that's previously been developed for use primarily in the brain, the process of stereotaxis, which is a localization method used in surgeries, but now used in radiation as well, which allows us to deliver a very high dose of radiation relatively rapidly in a very accurate and precise manner.
So I was on the capecitabine 2.5 years ago, and then this new lesion popped up, just a month or so ago, 2 months ago, and Dr. Hobday set me up with Dr. McDonald, and we looked at the stereotactic thing, and he wasn't here 2 years ago, so it's like, okay, this is all just lining up really, really well. Mayo's on the leading edge of things, and I just trust totally that everything they do for me will help me survive long enough until there's the next thing, because my cancer is chronic, so but all I have to do is be able to hang on, and this is the place where I get well. We have come here for everything. My husband drives me down. I've been doing the stereotactic radiation for 5 days, so he's driven me down and back every single day. He comes to every appointment with me because this is the place I can and will get well.
Today, what she'll be experiencing, just as she has with the other 4 days of treatment she'll be finishing today, her fifth treatment. She'll be led into the treatment room, and she's placed in a mold, a device that is used and created based on her anatomy to help her get in the same position each day prior to treatment. Once she's comfortably fitted in that device, which essentially is like a large beanbag, okay, with a sheet over it, we then use X-ray imagers in the room that are not part of the treatment machine, but that are available in the room, to then align her up to a standard point. And that standard point would have been defined when we first met, when we did what we called a treatment planning session. Once she's aligned to that standard point and we know where she is essentially in space, again getting back to that stereotactic localization, we can then deliver the treatment. The whole process for her takes about 20 to 25 minutes, the treatment. So 5 days, 25 minutes, and we're able to give 6 weeks of dose in that time. The really great thing about the whole thing is that she feels so great. She feels so well, despite getting all that treatment compressed, so to speak. She feels great, and the control that we find in the other sites, including in the lung, the spine, and the liver, where these treatments are delivered more commonly, are in the 80 to 90% plus range. Getting to the level of almost what we would consider with a surgery or removing the tumor or other ablative techniques. It was developed in the inoperable population in patients that couldn't tolerate a surgery because of medical reasons. And now what we're finding is that patients are choosing to have this treatment or seeking it out because they prefer to have a 3 or 5 day treatment rather than having for instance, a lung lesion, having a full thoracotomy and having a 6-week recovery from a major chest surgery. When it really comes down to it, it's in my opinion, it's a wonderful treatment for patients because they really do feel well, despite undergoing a therapy that is truly ablative in our minds and has a very high rate of control or tumor ablation, tumor kill. And yet it's not done with needles, it's not done with knives, so there's not the risks of bleeding and infections and anesthesia. Patients feel quite well with it, both during the treatment as well as after. And that's what's really impressive to me, is that not only can they get good care, but they can also feel well while they're undergoing the machine will rotate to 9, in this particular case, 9 different angles, and will deliver a quantity of dose from each of those angles.
Yeah, there was a family here the other day, and the dad had just completed treatment, and they were like, mom, daughters, whatever, and they were taking multiple pictures, and so anyway, here it is. Okay. Ring this bell 3 times well. Told to clearly say, my treatments are done, its course has run, and I am on my way. It's just a very relaxing atmosphere, and the staff has been so incredibly encouraging, as they always are. Every piece of Mayo works for me, and I have to say that this is such a different environment, and that's what impresses me so much, and why I'm a true champion. I work for General Mills, so champion is an important word to me, but I'm a true champion of Mayo, because if somebody doesn't know something, they have someone else right there who can answer the question. Dr. Hobday, if he doesn't know, he's talking to the radiologist and getting opinions even before I come in for my appointment. When I had the lymph nodes removed during surgery, I was on the table longer because they were doing a special test to see just how many and how invasive it was. And I have other friends who've gone through surgery, and they had to have that test later to find out just how invasive it was. And I'm not good at waiting. I don't have any patience, so this is the perfect place for me, because we can take care of everything at one time. Anything that's popped up, we've had an answer, and I've been gotten in really quickly, and so I have great comfort. It's not about me, it's about Mayo and what Mayo can do, and to give people hope, because it really is just a very, very hopeful place. When every time we come down, that's a comment that we make. It's the minute we walk in here, we have hope and we feel good. So it's never scary. It's just always comforting.